Welcome to the Plastic Surgery Secrets Talk, a podcast where we go behind the scenes of everything in the plastic surgery and aesthetics world. I'm Dr. Jeffrey Spiegel.
And I'm Dr. Onir from the Spiegel Center just outside of Boston. Today we'll be going over plastic surgery and aesthetics of the forehead.
But before we begin, I want to make an announcement. As you know, starting in April, Dr. Jacob Tower will be joining our practice. So it's going to be Dr. Spiegel, and Dr. Tower. Dr. Tower is a very highly trained, highly skilled facial plastic surgeon who's going to be bringing all of his experience to help us at the Spiegel Center and allow us to see even more people.
It's super exciting.
All right, so let's talk
about the
forehead. First of all, I just want to say what a great opportunity it is to sit down. It's been a very busy week. You know, we're on our feet all day, running around, seeing people. It's a great honor to do what we do, but it's just so nice to be able to sit down and talk about things in such a relaxed setting. And for you who's listening at home, in the car, on your run, wherever you are, it's such a nice chance for us to connect. So today we're talking about the forehead. How are we going to define the forehead? Well, you know, as in all parts of the body, there's so many different components, and each little subset area has a different consideration. For the forehead, we're going to start with the hairline and where it starts. You've got the hairline where it starts, you've got the hairline shape, you've got the hairline density. I think we're going to talk hair and scalp advancements and brow lifts related to hair in the future. But from now on, we'll go from the forehead where the hairline starts moving forward, and that's going to include your temples. It's going to include bony ridges. It's going to include bony bumps. It's going to include your eyebrows. And there's a lot there. You might think there's not much going on, but there's a lot.
It's huge. Didn't you come up with that paper? I remember years ago when I was kind of a newbie to injections, you were already presenting papers about the eyebrow. And I remember one specific paper that you published where you showed people, very famous people that we all know, like Brad Pitt and Jennifer Aniston. At the time, they were even more, popular because this was a while ago. And when you covered their eyes, there was a certain percentage that did not recognize them. When you covered their lips, their noses, what have you. When you covered their eyebrows, the percentage of people that did not recognize them was huge. And this is in the years when, Friends was going around.
When
everyone knew Jennifer Aniston then. So talk to me a little bit about that. I thought that I remember thinking that is so interesting.
Well, that's right. It comes down to what are the eyebrows for? If you look on the internet, the source of all information, it'll often say that the eyebrows are there to keep water out of your eyes. Of course, that's ridiculous. The eyebrows are not going to keep your eyes dry. Your eyebrows are, with very rare exception, a very distinct color from your skin. So if somebody has very dark skin, their very dark eyebrows may not be so visible. And if you have very light skin, it's unusual for you to have very light eyebrows, but that can sometimes occur. Most people will have eyebrows that are quite visible. And your eyebrows are really what allow us to recognize people. And it sends so much information. The eyebrows are sending information about who you are. Do I know you? They're sending information about, are you angry? Are you surprised? Are you threatening? And they're also sending information about, are you a man or a woman? And some things about your age too.
Well, that frowning and that angry look is definitely going away with Botox, so that is no longer relevant.
Not a thing anymore. Well, that and there's been a lot of good studies done on the effects of botulinum and Botox and Xeomin on how people perceive you. And what that really comes down to is when we can change the eyebrow position and get rid of some of those micro emotions, small squeezes, small senses of anger and stress, people interpret you as more attractive, more youthful, more friendly, and interestingly, more competent. Like people will, more trustworthy. People will say you're a better employee, a better friend, a better partner. So there's a lot of positives.
And for sure, a better mom or a better dad, right? Because I think this whole new generation is being raised in a whole different way, because when mom or dad scream, but you can't get those 11s frowning,
you don't have to take them
angry
seriously.
Lines. You're like, yeah, whatever she's saying, it's irrelevant.
That's true.
So I think maybe it's making our kids grow up a little calmer and nicer. I don't know. What do you think?
Well, if they can't see anger in your face and they ignore what you say, then for sure they're going to be more relaxed.
All right, so talk to me a little bit more about the whole forehead, like surgically. What do you do, like when you're there in the OR?
Well, first of all, one of the studies that we did a number of years ago, and it was an award-winning one, is we looked at the role of the forehead in how people see you in terms of your gender and attractiveness. And as you know, it is the forehead more than anything that helps us to see if a person is male or female or determine. Now, that seems like quite a big surprise, of course, because most people would say it's body parts, hip size, breasts, things like that. But the forehead is the key, and the eyebrows, and a lot of it has to do with
That
this
little
area
area.
here. And if you're listening to this podcast, you couldn't see where I was pointing, but it's the bone between your eyebrows, sort of a straight line up from your pupils of your eyes, the colored part of your eyes up, about just above the eyebrows. There's often a bony ridge. And if you frown together, the muscles contract over that area and makes it look more pronounced. And if you think of a Neanderthal, it's more pronounced. And so this glabellar bossing is the medical term, this bony area, is very important in determining gender and determining attractiveness. And a lot of women, young women, who have no wrinkles, no skin problems, no problems with their nose, no problems with their lips, no problems with their eyelids. If they feel less attractive, a lot of times it's going to be that bone is present, and that affects how people are seen.
For sure. And I think it's also very dominant. I think it's dominant in certain ethnicities too, like the Middle East or people of like very North European, like Viking kind
That's
of
right.
heritage, right? You always think of them with those very heavy eyebrows. So
That's right.
women and men, right, female and male, will be faced with that, and then they look kind of angrier or more masculine.
That's true. In fact, if you're from African or Asian descent, it may not be as much of a problem. It can be, but oftentimes it's not. And of course, people from those areas often have favorable fat distributions and things which help them to look better as time passes compared to others. But yes, that glabellar ridge is a big problem. Now, well, we'll talk about how we treat that area.
Yeah.
And then we should talk about the temples too, which is on the sides of the head. And we can also talk about other bony irregularities. People have little bumps on the forehead and things, which make them look, like an egghead or somewhat like an alien if the forehead looks too large or too swollen. And we can change all those things. And the way we do it is we hide an incision on top of the head. And where we do that depends upon a person's hair, as you know. If you have nice thick hair and a good hairline, we might go on top of your head where you can't see the incision at all. And if you have sort of a receded hairline, we might go right in front of the hairline because then we can move the hairline forward, a topic for another day. I hope our podcast manager heard that. We'll do that another day. And we move that forward, we adjust the eyebrows, and we can get there and adjust the bone. And as you know, that whole procedure takes 60 or 90 minutes and is safer than getting your tonsils removed, as incredible as that sounds.
Well, you published a paper showing that you had like 0 infections, and you've been doing this operation for what, 15 or more
23 years.
23 years. Oh my God, time just flies. But how many? Did you have any? I mean, because I know you present that data. You just presented it at first event. So how many complications in 23 years?
Well, we have had 0. Yeah, 0 complications, other than once in a while if somebody has very, very thick skin and a problem with their healing, you can have a little bit of a wider scar. That's less than 1.5% of people, so almost nobody. And we haven't seen that in years because we've come up with some new ways of preventing that. But no problems with the sinuses. We presented that. No problems with nerves. You have some temporary numbness on top of your head, and it gets better. And we also open up the eyes. The eye socket area is opened up as part of that. And women, and attractive women, have big, large eyes. When you look at cartoon characters of beautiful women and drawings of beautiful women, they always have large eyes. And sinister or unattractive people are drawn with smaller eyes. So this is a way we can actually change those ratios and change the brightness of the face.
So 23 years, how many of those do you do like in a week?
3 to 5.
3 to 5 times, like, let's just say Less than 50 weeks a
I
year.
think the
That's right.
podcast people don't need to do math.
Yeah,
They want to talk beauty and not math, but
yeah,
it's a
yeah.
lot. We've
But
done a
it's a
lot of that.
lot. I mean, you've done thousands of these
Yes,
forehead operations, probably more than anyone else in this world. Right?
I think that's quite likely.
So there you go.
So let's talk, though, about non-surgical treatments of the forehead for a moment,
Yeah.
and what happens to the sides of the head and how that affects how people are seeing sort of the sides of the forehead.
Well, I guess that's where I jump in, right? About fillers, fillers to the temples. I talk about it all the time. It's the one thing that makes people look so much younger, especially in people who are very thin. Um, their temples, you're going to see their temples kind of concave in. And for a lot of those people, they'll go and start to get fillers in their cheeks because as you get older, you want the skin to be pulled back a little bit. The worst place you can put it is on the zygomatic arch of your cheeks, right? Just in the cheek in the back, because it's only going to emphasize more the concavity of your temples and make you look a lot older. And that's especially relevant to Caucasian women. So other ethnicities, theirs will maybe a little bit rounder on the top of their head,
Yeah,
which
more
makes
favorable appearance.
right, and that makes them look a little bit younger. For Caucasian people who get that peanut,
Yeah,
a
the
little
peanut
bit,
shape is exactly what it
that
is.
peanut shape makes you look so much older. So you can have the perfect lips, the perfect nose, the perfect cheeks, the perfect chin, what have you. But if your temples are sunken in, you will look older.
Yeah, and that's a key thing. It's all in the details. And sometimes you'll see people on social media or in the media in general who have had cheek fillers, and your impression is going to be, oh, their cheeks were done way too much. Looks terrible. Well, maybe not. It might have been done okay, but it's out of balance with the temples. And it's not that the cheeks are wrong; it's that the temples are ignored.
All about balance, right? That's
Yeah.
what it's all about. So let's move from the temples further in a little bit, the crow's feet. That's another area that when you smile and when you're young and you smile, you're going to have those lines, and that's perfectly fine. But as you get a little bit older, those lines remain there when you smile because the skin quality is just
Yeah,
not
it
as
gets burned
good.
into your skin.
Right. So one of the ways to treat that is with botulinum, aka Botox Xeomin Dysport, um, and it's just opens it up, and it also you can also use that botulinum to reshape the eyebrows. So just like we were talking about the eyebrows as being a distinctive feature to tell someone apart and masculinize someone or feminize someone, when you put botulinum, when you inject it to the crow, so we can shape the eyebrows just with botulinum, those simple Botox injections to the lateral side of the eyes to do away with the crow's feet, those fine lines that make people look older, but it also can help tremendously raising the eyebrow and making the eyebrow just look so much more feminine. And another way of doing it is just what we talked about with the temple injections. So temple injections, just filler injections, which just we go right with the needle into the temple. I always tell my patients there's that big thick skull there that protects your brain, so nothing to worry about, even though it feels a little weird because you hear click, click, click
Yeah, from
of
all
the
the fascia
syringe of the
layers.
filler going in there. Um, and um, and it expands that area, bringing it back to what it used to be. So the filler in the temples, together with the Botox for the crow's feet, really raise that eyebrow, making it so much more feminine and beautiful.
Yeah. And if you have a free hand as you're listening to this podcast, go ahead and feel the side of your eyes, and your eyebrows should be about half an inch above the eye socket on the side.
Hmm.
So that's how you're going to know if your eyebrow's in the right place. And when you do an injection of a agent such as Botox or Xeomin or one of these other things in the crow's feet area, we've shown in studies that you'll get about 2 to 3 millimeters of eyebrow lift to the side. Now that may not sound like a lot, 2 or 3 millimeters, and it's not a lot in certain things, but in the eyebrow position, that's huge. And you can really get a very nice lift in what people used to call a chemical brow lift because it's a medical or chemical that is used to lift the eyebrows instead of surgically. And that's a very, very powerful way to change it. And not only you can lift your eyebrow, but when your eyebrow goes up, it takes away some of the hooding of the eyelid. So it gives you sort of a blepharoplasty or an eyelid lift effect as well. So that's going to open your eyes in two ways. So it's going to help you look more feminine. It's going to help you look more awake. It can be done in a way that will not make you look feminine if we're going to lift the eyebrows in a flatter way, meaning more across instead of an arched way. So that'll open up men's eyes. And it can be, a very powerful change. And like you said about the temples, temples can be filled in very easily with a host of fillers, right? You use calcium and hyaluronic acid. What's your favorite?
So I think a combination of both. It really depends. Sometimes I use one, sometimes I'll use the other, and sometimes I'll use both. So it kind of varies from patient to patient. But you just brought up a very interesting point that some people, especially men, will go. So let's face it. Let me backtrack. Let's face it. More women do Botox than men, right? It's just globally, worldwide, it's just the way it is, right? Women care more about their aesthetics in general, not everyone, but in general. And many nurse injectors tend to be women and they treat women. So they have their routine to bring the eyebrows very beautifully up and give you that reverse V shape, and it looks beautiful. And it will look beautiful on most women. But men, it will look really odd and weird. So for men,
Mr. Spock from Star Trek.
yeah. So for men, if you're looking to do Botox because you're not happy with the heavy lines across your forehead or the 11s,
or the headaches or the tension.
Yeah, so make sure you go to someone that injects men and does your eyebrow in a very masculine fashion. So you have to go to someone that knows to inject women and men and make sure that the eyebrow fits the person that you want to present to the world. So if you're a man and you want to present as a man, a very good looking man, then you better have a flatter eyebrow and go to the right injector who will give you that. And if you want to be a beautiful woman and have big eyes and the eyebrow way up high, make sure you go to someone that knows to inject just the way you want it to be injected.
That's right.
So we know many actors that you look around, you'll look at their eyebrows and you're like, what did they do? The most famous one, sorry, Sylvester Stallone, but you're it. You know, you've been going to the wrong injector. Your eyebrows are so feminine, unless he's
no, it looks crazy.
To get that look, but
yeah, no, he absolutely looks like he's getting his Botox done wrong. His eyebrows are arched and feminine and pointed, and it's just not right. Especially for someone who tries to portray sort of an uber macho action hero character.
Right. So anyway, if you're a man or you're a woman, go to someone that knows how to inject Botox in a masculine way or in a feminine way. And those two ways of injecting are very different.
What if I'm scared about this? What's the worst thing that's going to happen from Botox?
Well, the number one problem with Botox is bruising. And most people do fine with it.
And it's not from the Botox. That's from the needle.
Yeah, it's just a needle. So you'll be fine, 2-3 days later. You may have like a little, green or blue bruise, and that will go away.
Yeah, it's tiny.
Yeah.
Kind of a badge of honor, really, nowadays. It's like, look at me, I got my Botox done. It's better to have it than to not in some ways.
And the other one is drooping an eyebrow. So again, talk to your injector when you're going to get your Botox done. Make sure that they know not to drop the eyebrow. And the way to avoid it is very simple. You just cannot go too lateral. So if you go too lateral, you're going to droop that eyebrow. On men, you want to go a little bit lateral because you want to flatten the eyebrow. But on women, you do not want to go too lateral on the forehead so that you don't droop the eyebrow and you keep the eyebrow way up high. And as I tell people, you may have that little wrinkle above your eyebrow on the very side of it, and it's almost like known as the Botox wrinkle, and that's okay because that's the real badge of honor.
That's the badge of honor. You do 200, 250 people with Botox for every one person that I do. But the ones that I do are always complaining that they're scared because it's a toxin. And can I just talk to the company that makes this? Is it Pfizer? Who makes Botox? Allergan. Allergan. What's the matter with you with the name Botox? Botox toxin. Why didn't you call it like Relaxify or
Yeah.
something? Or Calmify
Listen,
or Beautify. Crazy name, Botox.
the way I say to all my patients, every medicine is some sort of a toxin, right? It's a beta blocker, it's a
If you
calcium
use the wrong
enhancer.
dose, it's dangerous. If you use the right dose, it's helpful.
Exactly. So, yeah, they didn't pick a great name for it. It's still doing pretty well. And the truth is we also have newer products than Botox. I, for example, love Xeomin.
That's a terrible name too. But anyway, we won't talk about that. And now there's Daxxify. Daxxify is a hot topic. It's supposed to last longer than Botox or Xeomin or Dysport, maybe even up to double. And the word on the street amongst people who are using it a lot is that's not happening. What have you been hearing about this?
I've actually been hearing the same thing. So we did not rush to bring it in because there have been all kinds of products along the way that come in and then
Quo,
they
for
get
example.
yeah, a good example because that came out like right after COVID came out to the market, and within 6 to 7 months it was pulled off the market. I don't want to do that to my patients. I don't want it done to me, and I don't want it done to my patients. So my patients are asking about Doxify. I say to them, you know what? Let others test it out. And after 6 months, when everyone's feeling all good about it, we can start exploring it. We did the same thing with
Kybella.
Kybella. We were one of the first ones to bring it to the market in New England for sure, and in the country. And it's a good product. It still is a pretty good product, but
When used right.
when used right,
It's
yeah,
overused.
but also there are other ways to achieve the same results.
Yeah, more
And then
predictably.
yeah, and then you don't get that turkey neck and you don't get all the problems and you don't get all the injections. Just go for fat freezing. Way better, I think, than Kybella. So we're more mature in our work, right? We're a little bit older.
Well, we've been
So
around longer.
we've been around longer. So we've seen things
I
come to
think
the
the word
market.
experienced is what
Yeah.
you were looking for.
Well, but also mature. Things come to the market, they leave the market. So if you're, don't rush into things. Wait till others try it. Make sure that it works. Make sure that it works right. And if it does, we'll bring it in. But the word on the market is that it doesn't really
It's
last
not
up,
living up to its
yeah,
hype.
to its hype. But we don't know yet. So
It's
I'm
going to have a
keeping,
role. We're going to see how that goes.
yeah, and I'm keeping,
Keeping an open mind.
Jeuveau came along, and that was it still is a great product. And the way I tell people, some people like tequila, other like, vodka.
Mezcal. Yeah.
So it is what it is. And some people like Botox, other people like, Dysport, and other people really like Xeomin. I love Xeomin. I see the results the night of when I inject it, literally. My patients, I see it on myself. By 8 o'clock or 9 o'clock at night, you all of a sudden start to see the eyebrows.
And you feel the relaxation.
Yeah. So it's a beautiful product, and it kicks in a lot faster, for example, than Botox. And they all last about 3 to 4. I can make mine last for 5 months in the 11s and the forehead. But the sides of my eyes, the crow's feet, I can't make it last more than 2 months. That's because I'm not 20, 30, or 40 anymore.
There you look at. I use the analogy of paint. I feel like these products are like paint. There's all different brands of paint, and the real skill in the paint is not the paint; it's the painter, and that's the way I see these products.
Thank you for listening to Plastic Surgery Secrets Talk.
If you like what you heard and you want to get in contact with us, you can call 617-566-3223. Those last 4 letters spell face. Or email us at info@drspiegel.com. And you can always ask us a question for yourself or suggest a topic for a future podcast. And finally, follow us on social media at Dr. Spiegel. Remember, I before E. See you next time.